Understanding all the treatment options for fibroids is important, but choosing the right one is probably even more important. Some women with severe symptoms from fibroids can be treated with medications as a short-term bridge to a surgical procedure. This allows time for the fibroids to shrink and can help the doctors and the surgeons prepare for an upcoming procedure. However, again, medications are only temporary, and the strongest of the medications can only be used for several months. Because it's inducing a menopause-type state, a lot of significant side effects can occur if those medications are continued for longer than 3 to 6 months. Some women with fibroids who are seeking to become pregnant can take oral hormones to help shrink the fibroids down, stop the hormones, and then become pregnant after the hormone therapy is stopped. So for women with minimal symptoms and who desire fertility in the near future, medications could be the right choice. Minimally invasive treatments such as uterine fibroid embolization, myomectomy, and ablation play a very important role in your options for treatment. These treatments allow you to preserve your uterus while still giving you symptomatic relief. Myomectomy is one of the best choices for women with a solitary fibroid that's a small enough size to remove either laparoscopically or robotically. This allows a woman to be treated as an outpatient and with minimally invasive techniques. Recovery for a myomectomy is much quicker than for a hysterectomy and is one of the benefits. However, myomectomy can allow for other fibroids to grow in the future. So a woman who has one fibroid which is removed could allow additional fibroids to grow in the future. One of the benefits of myomectomy is that the fibroid itself is immediately removed with the surgery. It doesn't take time to shrink, and the symptoms are immediately resolved after the surgery. Although myomectomy does have benefits, certainly some of the downsides are that it is a surgical procedure and requires general anesthesia, depending on the type of surgery performed, and depending on how large the fibroid is, could require open surgery. Ablation therapies is another minimally invasive treatment option which could be used. One of the benefits is that it is outpatient and requires little to no recovery afterwards. Women can be treated at a surgical center, the endometrial lining could be ablated, or the fibroid itself could be ablated. It allows for quick recovery and often a quick resolution of their symptoms. Choosing a treatment option is one of the most important decisions that you'll make for your fibroids. That's why we encourage you to either see your gynecologist or see our center so that we can discuss all of your symptoms as well as the appropriate treatment options that might be available to you.
I chose uterine fibroid embolization because I was definitely looking for a minimally invasive procedure. And with UFE, there's not a large scar. My scar is actually the size of the nail on my pinky finger, and the downtime is short. There's no mandatory hospital stay, which is good because you can recover at home. And the best thing is you get to keep your uterus. And also the fibroids that are treated with UFE do not grow back. So all of those were determining factors for me.
The one that sounded more attractive to me was the UFE because it was minimally invasive, because I didn't want the trauma of going to a major surgery if I didn't have any symptoms. And so I just felt that that was the best option for me. The reason that I agreed to do it because after talking to some friends and listening to the side effects after having a hysterectomy, 2 of them told me they basically regret it. They basically wish that they hadn't done it, or that they had been offered other choices, because maybe they would have ended up having a hysterectomy no matter what, but if they had known that they had other choices, perhaps their decision would have been different. And this is why I'm doing it, basically to, if I can help somebody out, even though it's very personal and you talk about, your bladder and things like that, I felt that I owed it to, the rest of the people who are doing research, that, that they're aware that there's other options. And I also think that this is a good wake-up call for me to never just take the opinion of one doctor in this day and age where there's so much information. And I think that we have to use that to our advantage and find doctors that are, keeping up to date with alternative for treatment that is not just what has been done 20 years ago. Their testimonial, actually, a very close relative of mine had a hysterectomy 30 years ago when there were no other options. And she's the one who said, I wish that I had had more options back then. And perhaps 30 years ago, I think it was about 30 years ago, perhaps at that time there were no other options. And so she's a nurse. And so she said, there's definitely other options. And so you need to go down that route. And if you have to get a second opinion, get a second opinion. If you have to get a fourth, a third, and a fourth, then get as many opinions as you can, because it affected her marriage in a big way. And again, this happened 30 years ago when she had no choices, and I feel like I do now, so why not try it? Even if it buys me time,